Yes, it's me, Dr. John Clarence Morales Membrane. It has been quite some time since I did a demo procedure on myself, so I'm doing makeup. So now I'm going to do a little bit of a skin lifting procedure, a non-surgical skin lifting procedure on myself as usual. It is because I always go to the gym, and when you go to the gym, usually your face sweats a lot and you lose a little bit of the volume. So when you lose the volume, there's a tendency for the skin to be loose and sag at the same time. So I have a little bit of a sagging on this area, although I don't know if you can see it very well or more prominent. It's more prominent actually in person than in the video. So there. Now, for now, I'm going to use the HiFu. The first handpiece that I'm going to use is the D4. The D4 goes deep up to 4.5 millimeters underneath your skin. It actually targets the S mass. It is the sheet covering the muscle. So what it's going to do is going to tighten the muscle around, there's a sheet around the muscle. And then in return, there's also going to be the collagen regeneration. So there's going to be a tightening on the area. Again, this is the D4 handpiece. It goes deep up to 4.5 millimeters down your skin, up to the S mass, which is the sheet that surrounds the muscle. And when you target that, it's actually going to tighten that sheet around the muscle, so it's going to tighten your muscle at the same time. Plus, there's also the collagen regeneration. So when your collagens are tight, because when you age, your collagen is like parang lax na siya, ganyan. But when you target it with the HiFu and the Intragen, which I'm going to use later also, it's going to be taut again. So chain reaction, when your collagens are taut, it's going to be tighter. So I'm going to start. Actually, I'm just going to use a low energy for myself because I can do it anytime naman. But for my patients, I usually syempre use a higher energy para sulit. But for me, low lang. Medyo masakit, yeah. Because it's deep. If you don't feel anything, that means it's actually not working as it's supposed to. So we're just going to put a little bit of the gel. Me, I'm just going to target the lower part of my face. Because I just want this to be more contoured or tightened. So what's the feeling? The feeling is a little bit parang drilling on the area if you're going to use a higher energy. But since I'm using a low energy, it's tolerable, bearable option. So just going to spread the gel. So I'm going to do an upward direction because I want it to be tight on that area. So you can do put air. On the bony parts of your face, you can feel it kasi diba, it's deep na, it's 4.5 millimeters, so you can actually feel a little bit distinct. Can you see? Kahit ay gel pa siya, medyo mas if you're going to ask why am I just using few shots, it's because I always do it, diba? So I just need a little bit of a boost. Kaya few shots lang, I'm going to use a few shots. But it's important also not to forget your jowls area or your jawline, your neck area, diba? Those are the areas that are usually being left. You also have to target that because those areas also sag. Mas contour na siya. Then kanina. But I forgot my under the chin. This one, this area. So we want to again, diba? Para when you do the side view, you can see the contour. You see more contour there. But of course, this effects is not it yet. Kasi it's not really super immediate. You have to wait a few more days, a few more weeks for the collagen to regenerate pa more para the tightening will take effect. At the same time, of course, you're tightening the S mass, so it's not really immediate. The tightening, it's not going to be immediately, diba? You can see a little bit of a difference, but that's not it yet. So it's a procedure. Since it's non-surgical, you expect that there's a process. Okay, it takes time. It takes a little bit more days or a few weeks before it really takes effect. There, but medyo contour naman siya. Okay. So after we did the D4 hand piece, we're now going to proceed with the next hand piece, which is the D7. By the way, again, I'm using the thru machine. It's a HiFu machine. It's a high frequency ultrasound machine. Goes down deep into your S mass. The S mass is the sheet of the muscle. To tighten the muscles, more contoured look, lifted look at the same time. So this one, the M7, is the second hand piece that I'm going to use, is for the more shallow parts of your face, skin, and S mass. Because the other one, the D4, it was 4.5 millimeters deep. This one is just 3 millimeters deep. So it's not as painful, uncomfortable, not as uncomfortable as the first hand piece. So let's start just a little bit. Put a little bit more gel there. The gel is just actually just a conductor. Concerned that you're going to hit the thyroid area. I'm actually not. It's just under the chin. I'm just hitting this part. This part. It's just under the chin. Okay. Other side. we're done with our HiFu, the blue glow. Next stop is we're going to do the Intragen, but first I'm going to wipe this off. Okay, so our next procedure is the Intragen. I did tie my hair just like a while ago, so medyo magod. Ang dami kong clip na para I can see my face more. So the Intragen, this is the tip. This is the handpiece of the Intragen. It has that tip. You can see it's a removable tip. It has a number of shots. There's a counted shots, just like in the HiFu. There's also a number of shots, and there's a card. What it's going to do, what's the difference between the Intragen and the HiFu? The HiFu, as its name implies, it's high frequency ultrasound. It's deeper. It uses ultrasound technology to tighten the S-mass, while the Intragen uses a fractional grid RF technology. But it's different from the usual RF that we usually use or usually see in other clinics or salons that is lower. Their energy is a little bit lower and more shallow at the same time. This one, it's more deep and the energy is also higher. And with the fractional grid, so the computation of the energy going deep under your skin is more computed. So the target is your skin. It's more, it targets your collagen more as compared to the HiFu. The HiFu targets your S-mass, which is deeper, so it's near the muscle, while this one targets your skin at the same time only. Targets your skin, the collagen of your skin. It targets the collagen of your skin so that your collagen will regenerate. Because when we reach the age of 20, our collagen actually depletes. Diba? If you're going to notice children, kids, babies, their skin are so supple, so tight, so smooth to touch because it's full of collagen. But as we age, starting from the age of 20, the collagen depletes. It goes down. So nauubos yung collagen natin on our skin, especially on our face. Plus the stress factors, the puyat, the food, the lifestyle, the makeup that we even use. Yan. Somehow, these environmental factors can cause the depletion of the collagen. But there's nothing to worry because we already have non-invasive machines or treatments to regenerate them. So this is it, the Intragen. So again, the Intragen is for the skin, to tighten the skin, to regenerate the collagen even more. So when you regenerate your collagen, it's not just going to be tight, but it's going to be more smooth or smoother, but at the same time, it would look plump, pero not matabang plump, na volumized plump. It's yung parang healthy plump, young plump yung dating niya. Yan. So, I'm going to start. Again, I'm going to put a coupling fluid on my face. Ooh! Tumulo ang coupling fluid natin. So, kinakata na ako assist. Kasi busy sila. Yes. They're all busy. So, we're just going to put a little bit of the coupling fluid here. The fluid is again just a conductor. So what's the feeling? It's actually hot. And it's not working yet. I'm just spreading the fluid all over my target areas. Movement areas on there. Again, since it's me, I'm going to use just a low energy for this demo because I do it all the time. Diba? But for the patient, syempre high. Para split. So here, okay, let's start. I didn't draw anymore kasi nga wala akong assist. But usually you can still draw the grids. Pero medyo memorize ko naman na siya. So we're going to start here in this area. So wala pa siyang well. Because I want to lift my eyes at the same time. Okay, 1, 2, 3. There. Although, there's also a special handpiece if we just want to target the eyes only. It's smaller. Because we can also lift the upper eyelid. Diba nagdo-droop din yan sometimes. We can also lift the upper eyelid, but the tip should be smaller. So, I'm just using the bigger tip because I'm going to do my face, not my eyes anymore. just the eye bag area. Yeah, just going to put a little bit more fluid. So I'm going to start again. Wait. Eye area. So what's the feeling? It's hot, warm. Actually, so we're going to start in the eye area. Matulog, sorry. During the treatment, the patients will feel the warmth. Some might even get scared na baka may ma-burn. But actually, there's not going to be any burn at all because the RF, it's under the skin, not above. So you can see a little bit of the redness, but you won't burn the skin, so it's very, very safe. And also, the temperature is computed at a point that it's not going to destroy your skin or the surface of your skin, but instead it's going to regenerate, denature the collagen and regenerate it in process. We sometimes also do this to patients who want to make their face a little bit smaller, but we have to reassess first that not everybody's face will become smaller just because of the non-invasive procedure. Sometimes we have to combine it with other therapies, especially if there's a lot of fat or volume under, because these are all tightening, skin tightening, contouring. So if there's a lot of fat under, no bad na. You can see it's more tight. The feeling is tighter. And as the day goes by, usually after a week or two, the difference is more prominent or more evident, and the feeling is also more prominent at the same time. You can see it tighter. Usually, you can see it in the pictures. If you have old pictures or not so recent pictures, or pictures that you took before you had the procedure, and then you take the picture on the same angle, same lighting, you're going to see the difference. You look fresh, or more fresh, younger looking, but natural. That's why it's an alternative to surgery. So it's a very nice alternative to surgery. Oh, by the way, the machine at my back is the cold sculpting. Next time I'm going to do a demo on that naman. It's a permanent fat removal using cold technology, cryo technology. I'm sorry naman for my clip, magkaiba siya. Because I just needed to make my hair look clean. So there you go. And we did the HiFu and Intragen for our anti-aging regimen or anti-aging procedure for skin tightening and contouring. So I'm just going to wash off my face. Thank you for watching.